Hi, I'm Helen Kuhl, and I'm in Charlotte, North Carolina at the 2012 AAPM meeting. I wanted to introduce Dr. Sabee Molloi. He's professor of radiological sciences in the School of Medicine at the University of California at Irvine, and he and his team are going to be presenting the findings of a study they've been doing on spectral mammography. They're going to be presenting it in a couple of days, and I'd like to introduce Dr. Molloi to introduce his team and tell us a little bit more about this exciting research.
Yes, this is Sabee Molloi from University of California at Irvine. I'm here with Dr. Huanjun Ding and Justin Ducote, and we have done some work on spectral mammography. And initially, Dr. Ducote will talk about some introduction on spectral mammography, and then Dr. Ding will follow.
Thank you. Our work here was focused on in spectral mammography was focused to measure an underutilized risk factor for the detection of breast cancer, which is breast density. Breast density is the percentage of glandular tissue in the breast. We were working on developing a quantitative technique to measure this risk factor. This is an extension of our previous work from measuring breast density in plain 2D projection mammography, where separate images were acquired for 2 different mammograms. We have a new novel detector which allows us to measure this quantity in a more streamlined way. The significance of breast density is there has been an observed association between high levels of breast density and an increased risk of developing breast cancer. And for some of the finer points of the new technology, I'll hand it over to Dr. Ding to tell more.
Our group at UCI has been working to develop an accurate and quantitative measurement of the volumetric breast density through a standard mammography screening technique. Most recently, we investigated the feasibility of developing quantify volumetric breast density with a spectral mammography system. The system is basically based on a photon counting detector, which is an emerging technology that is very different from the standard detectors that is currently used for medical X-ray imaging. The detector has the ability to count individual photons and sort them according to their energy. Therefore, within one single scan, we can acquire low and high energy images simultaneously. And with this information, we can calculate accurately the volumetric breast density. Another great advantage of this technique is the photon counting detector can effectively remove the background noise. This means that the image quality can be improved a lot. Or in other words, if we compare to the current imaging technology, under the same image quality, we can reduce the patient dose up to 50%. And that means the radiation risk for any patient going through this kind of screening exams can be reduced. And that's a major benefit for medical X-ray imaging too. So in the current study, we use this technology to evaluate the breast density measurement. We did simulations to predict optimum imaging conditions using the proposed system. We also performed phantom studies with breast tissue equivalent materials. And the results suggested that the volumetric breast density can be quantified with an error level less than 2% with the proposed system using our technique. And this new information hopefully can help to identify high-risk patients who may benefit from more accurate diagnostic procedures.
It's very exciting to hear about the results of this study. And what will be the next step now? What will you do next in the future to continue with this?
We are setting up to do a validation study. We'll follow this validation study with human studies in the clinic to test the viability of the technique in the clinic. Thank you.
Well, thank you very much, and we'll look forward to hearing more in future shows.